Welcome, everybody. We appreciate everybody's time this afternoon. My name is Travis Ansel, CEO of HSG. Today, DJ and I will be providing an overview of HSG Dashboard, which is our data visualization environment for our clients, where we publish a number of data analytic oriented solutions that we're working with with a number of health systems across the country on. In terms of HSG, we work basically nationally with mostly nonprofit health systems in the areas of claims data analytics, so helping apply claims data to the market and learn more, especially about the outpatient, ambulatory, and provider office space and how that can help shape our strategy. We do a tremendous amount of strategy work for health systems and their employed provider networks. We are a leader in helping health systems evolve their approach to employed provider networks and how they build competencies and build operationally and financially sustainable networks. And we do a tremendous amount of compensation work as well. But with that background, one of the paths we've gone down in the last few years is trying to answer the broader question that we've seen as we've worked across health systems in this country, which is health systems have a lot of data, but they don't have their arms around that data. And what I mean by that is there's different data sets that live in different departments with different leaders within the organization. It's in different formats. It's in different time frames. It's it's from different vendors. And when you do strategic planning, market planning, provider growth planning, service line planning, there's a lot of different inputs you need, and that you need a lot of people within your organization to understand and look at in the same way in order to make sound strategic decisions. And so as we've kind of evolved our approach, we built what we call HSG Dashboard, which is again our Tableau-based data visualization environment that both our team and our clients utilize. And we really focus on a couple things in there. So we blend our approach to utilizing all payer claims to understand the outpatient, ambulatory, and provider office sites of care. We leverage inpatient data to understand, of course, what goes on the inpatient side. We leverage our clients' data to kind of create a comprehensive picture that's both what's proprietary to us, what's public data, and what is your own data, and bring that all together to create informative data visualizations that drive strategic thinking for executive teams, planning teams, employee network leadership teams, marketing and business development. But where we found a lot of the value in our relationship, as being consultants first, is we built our approach to helping health systems use data in kind of a consulting fashion. And so we've kind of built a team that works with each of our clients in this HSG Dashboard space, not to throw a bunch of data and information at you and walk away, but to help with the translation of data into how do we really utilize this? How do we push information throughout our organization? And so as we've kind of evolved that approach over the last few years, we've built a number of products which live in HSG Dashboard. Our proprietary approach to building outpatient and ambulatory market share. Same thing on the inpatient side, from our what we call patient flow, our look at how patients experience the care continuum, and what does that tell us about provider to provider relationships, especially primary care to specialty care, and what does that say about our ability to retain patients. We created our proprietary approach to basically measuring patient healthcare spend and how much does our health system capture of it, and we publish that in there. We have a number of provider level market share metrics, and DJ is going to walk us through all of these. I'll just talk about them for a second. And then we also look at things like recruitment planning. How do we put data to helping us size our provider workforce needs, and what does that look like in a competitive market? So all of those things live in there. But again, where we think the value that we've been able to create in building this environment with all these cool analytics is, it's all in one place. It's visualized, so it's not spreadsheets upon spreadsheets. It's easily interpretable by everyone within your organization. The way that we've approached it is to build it to be both retrospective and kind of measure progress period over period going forward. So with all of our clients, we take them back as far as we can. And on the claims data side, that's 2019, and kind of look at, where were we before COVID? What happened over COVID? And where are we going? And then when within the dashboard environment, it is a data-driven interactive environment, but we also work to help our clients build reports out of it that we can pre-populate within the environment, and arm your team with not being data analysts where you have to create your own reports, but where you have something that is applicable to distribute to your executive team, to summarize where are we in the marketplace, to your service line leaders to give them a depth of information they've never had about their service lines, to your employed network leaders, so they can understand the dynamics of what's going on the employed network side. So we built that. And then, as I mentioned earlier, we built a team that supports your team, and make sure that your team has access to technical resources, has access to educational resources that can work to enhance your organization's understanding of the data, as well as our thought leaders on the strategy, employed network, and compensation side that can help you contribute to the strategy that the data is helping you build. And so we have a number of solutions. As I said, DJ will walk through each of those. It's a heavily visualized environment. So what you see here on the left is really what you'll see when DJ kind of walks through some of our analytics in the HSG dashboard environment. And on the right is, again, exactly what I said. We want to help you also pull data out and create PDF-based reports that can be pushed throughout your organization. And talking about how do one of the frequent questions we get is, is this appropriate for my organization? And so it's from a client-based perspective, HSG, we work almost purely with health systems. We in this HSG dashboard space, we work with everything from academic medical centers, some of the largest in the country, down to critical access hospitals. It's applicable to every market because I think so much of what we do in the data analytics space is really focused on provider, and it's focused on outpatient and ambulatory, which we think are the critical pieces that organizations have to understand to shape their strategy. So really, we think it's applicable to every health system type across the country. And we also work with hospital associations to try to push data out to their members as well, because the hospital associations, again, historically depends on your state, but very good at aggregating inpatient data and pushing that data back out to their members, but generally a little bit less so on the outpatient and ambulatory side. So we've been able to become an effective partner for hospital associations there as well. There's a couple other slides here just about our approach. And this presentation is, of course, available to anyone attending today's session. So we'll be happy to get that out to you. But basically about the resources for what DJ is about to show you, what resources exist to support your team, and how do we make sure that we're not just giving you a data environment and hoping that you use it, but having a real clear plan for how do we get you and your team engaged from the start? How do we get the data? How do we take in your data to make our data as right as possible? How do we onboard your team, educate your team? And then how do we start a process of, once we kind of get past the education piece of, how do we start working together to integrate the data into your organization and use it strategically? And then how do we continue to do that over time, so that we become, more synergistic partners? So that's just a little bit about HSG Dashboard. With that, I'll turn it over to DJ, who will do kind of a live walkthrough within the HSG Dashboard environment. DJ?
Perfect. Thanks, Travis. And yeah, I'll echo Travis. Thank you all for joining today. The part is where I'll maybe focus is this is a demo HSG Dashboard environment. I guess, let me double check. Can you see the screen, Travis?
Yes.
Just confirming. So being able to say, as we kind of have built what this is out, kind of with three main initiatives in mind. One, we know, and people have told us the past number of years as an organization, they like to be able to access their own data. So that a big component. How do we make sure that clients can access their data on a regular basis? Two, how do we take complex data sets or data from numerous sources and turn it into information that feeds strategy, operational initiatives, whatever it may be, that being a major second component. So the translation of data into information side. And then the third that is we really focused on is ongoing education and support. So I think as we entered this space and have continued to, be transition as an analytics and advisory organization, a lot of what we've heard in the marketplace is that there's lots of great analytic organizations and SaaS-based companies, things like that. But the professional services side are probably lacking from a lot of those organizations as they want to be more turnkey. They just want to sign a subscription and kind of move on. Where our goal, obviously, we want to make sure that the information and data insights we're providing are being applied to the organization, the decisions you're making internally. So really having that be kind of a larger focal point as we've kind of built out what this environment is and can become. So a few things I might highlight as we walk through this is talking through each of those a little bit in turn. So starting with the very first one of just pure data access. So how do clients actually interact with the environment and what data points can they kind of continue to look into? So within each structure, based on the relationship that we kind of work with the individual clients, they have what we term a My Workbook section. So you can see based on the relationship type that we have with the organization, they may use, like Travis said a little bit ago, numerous data sets. They may use HSG's proprietary claims-based data set. They may use state level data sets. They may use internal data sets. There might be all these different communication pieces coming from within their organization or outside their organization that we need to pull into one place. So where I might start a little bit is focusing on some of the things that are HSG proprietary, the all payer claims data set. So just I'll highlight a few of these workbooks, but as you kind of enter the environment, there are different elements and initiatives, workbooks as we describe them, that clients can access that are then obviously customized to them and their marketplace. So the most common of which of where I'll start is what we term our outpatient and ambulatory market share workbook. This is very focused on where do patients reside and how are they utilizing all of their outpatient services, both hospital-based outpatient, ambulatory surgery centers, imaging centers, Walgreens for pharmacy services, labs and imaging, things like that. So thinking physician practices. So getting a bit more broad than just the hospital outpatient departments is one of the main goals. So this is a sample of ours from the Lexington, Kentucky market. So we typically always use Louisville. We chose to go about 90 minutes to the east and use Lexington as a starting place to maybe show some samples where we're able to start to break down markets based on how patients are utilizing care. So this is taking what I would argue is I've probably spent more time internally than a lot, a very complex data set and turning it into valuable information that organizations can start to make decisions off of. And so a few ways we can start to think through that is if a patient lives in this, whatever 7 or 8 county market that we have kind of pre-selected, then that's the patient population that we're focused on. So those are patients that live, in this example, patients living in Fayette County, Kentucky, which is more or less the greater Lexington market. Patients that live there, where are they receiving all of their services regardless of geography? So we don't have any restrictions on state lines, any restriction. We have a nationwide data set that we can have access to and that our clients have access to. So they can say if patients are going up into Ohio, they're going to West Virginia, if they're going down to Nashville, to Vanderbilt, or, very specific, academic type services, that we have the ability to kind of track those across the entire geography of the nation. We additionally can break this down based on what service types are those and services are those patients receiving. So for this example, are they outpatient cardiovascular services? Are they evaluation and management codes? Are they pure what we kind of call other outpatient rehab services? So kind of a varying complexity of what we want those services to be. This is based on coding elements that kind of feed all of this based on actual procedure codes. And those get updated every single year. So when CMS AMA, when they release new coding elements every year, we actually update our service lines to reflect a lot of those changes on an annual basis. So if we have this cardiovascular component selected, we then can also see what are the sub-service lines within that. So we have cardiac rehab, diagnostic interventional cath, imaging components. So things that are very outpatient focused to say across all of these specialties, service lines and sub-service lines, how are those patients receiving their care across any one of those individual metrics? Then the last piece that's kind of the differentiator a little bit to a lot of other elements that we see in the marketplace is the ability to determine both technical and professional components of the claim. So technical is going to be more or less the location or the sites of care. So if we have technical selected here, you can see we have locations or sites of where those outpatient services are being billed and provided. If we switch this to professional, so I'm going to deselect technical and switch to professional, then the data set is going to update based on who are the actual professional entities or the physician groups. Lexington Clinic, as an example, a large independent group in the greater Lexington market, we can start to identify who are those actual physician enterprises that are servicing the patients as opposed to just the locations in which those services are being provided. That being a large differentiator from what we hear in the marketplace to be able to distinguish some of those elements. So other than that, we actually kind of keep things pretty simple and very on purpose because our goal is to turn, like I said, a complex data set into information. So then we have a roll-up of all of the Baptist Health locations. This would be what is their relative share of the marketplace for outpatient cardiovascular. So you can see patients in Q1 22 received roughly 120,000 services. 28% of that was provided by Baptist Health, the organization. That's going to, as you can see, the biggest shift here is around the UK healthcare component. So the kind of blue, where they've had a pretty significant increase in their market share for outpatient CV over the past, 4 to 5 reporting periods. And then one layer deep, a little bit deeper, is to be able to say, all right, if patients live now just in Fayette County, what is the volume that those patients receive, and what does our relative share of that market look like for just, a more defined patient population? There's lots of other elements I could go into here, but just for time's sake and kind of where we're at, I think a few elements I might touch on is just to be able to start to understand the level of granularity that a lot of our clients have access to. So this initial dashboard is intended to be very overview, oversight, but you can see there's lots of other incremental kind of views and dashboards that we have built based on questions that we hear very commonly from our clients around the country. So things that we hear over and over, we like to build. And so we build outputs that enable them to do that. But then back to the very first comment I made is access to data. That's a component that our clients continue to focus on. And so within most of our workbooks and outputs, we also provide what we call full detail dashboards and elements, where it more or less serves as an incremental CSV or Excel-based file, where you can have access to, like I said, anywhere in which those patients reside and receive those services. So these are patients in the Lexington, greater Lexington market we just had selected. If those patients are going to the University of Tennessee Medical Center, which is obviously not in that geography, and receiving outpatient cardiovascular services, that's the level of detail that those clients have access to on an ongoing basis. So that's one element around continued utilization of our proprietary claims-based data. One other that I might touch on quickly that we hear most frequently is what we term patient flow. It's, from what we hear in the marketplace, very similar to like a patient leakage type metric. So if a patient has an office, it uses the same data set. The difference is that we then put a timestamp on patient relationships. So patient has an office-based visit with a primary care provider, like Travis said, is where we typically recommend starting to say we think that's the best opportunity for incremental patient growth. And so if a patient has an office-based visit with a primary care provider in our selected market, for this example, actually, we've created samples where we're going to say it's an employed or an affiliate PCP of HSG Advisors. If a patient has an office-based visit with one of those primary care providers, we're then going to follow that patient for a 3-month time frame. We find 3 months to be a pretty good access metric for most specialties and subspecialties. And what we can then say is that if a patient went from our primary care to a cardiologist within that 90 days, for this example, 93% of the time, or over 13,000 patients, went to an employed cardiologist. 7% went to a cardiologist that's not affiliated with our health system in any way. So that would be the leakage or out migration piece, depending on what language you like internally.
Yeah, DJ, what I would add to this is, I think a lot of the value that we've seen our clients get out of this is, we obviously every health system tries to measure, referral retention out of their own EMR and their internal systems. And that's a great piece that every organization should do. But as we're able to put claims to the market, we're basically able to see the entirety of the utilization of the care continuum by the patient, both when it's interactions with your provider or not, whether it's referral driven or not. And so a lot of organizations, this has exposed them to a lot of opportunity that they're not seeing by looking at their own referrals, by, realistically looking at, looking at what's on the screen here. Orthopedics is a great example, where in 2023 Q2, this organization retained about half of its orthopedic patients. From an EMR perspective, that might be 90 to 95% retention. The EMR might show 90 to 95% retention because there's so much patient choice involved. There's so much, second opinion involved. So we're able to see, these are our primary care patients. We should be able to direct their care. What are the gaps that we're not doing besides managing the referral process that would allow us to have a little more steerage over the patient and keep them in network? And so that's where we've seen a lot of clients benefit from this type of approach.
Yeah, love it. So a few levels just to kind of talk through kind of roll up of elements is then obviously breaking that down by individual practice. So we know that patient keepage is not going to be the same from each individual practice that we have within our employed group and or in the marketplace. So if we have only so many hours in the day, how do we prioritize where we spend our time and energy if we're thinking about increased capture of patients for our system? So being able to kind of work through some of those elements, break it down by practice and or by individual primary care provider, ultimately, kind of being the goal, where we can then go to specific practices, have very targeted discussions with each, with individual providers on what opportunities exist within that marketplace or don't. And then the last place I'll jump to is the question we get most frequently. Let me, switch specialties real quick, is if those patients aren't going to our specialist, then where are they going? So this is then a breakdown. This is going to be, I switched to general surgery. These are the general surgeons in which those patients are going to within that subsequent 90-day window. So we can truly understand individual provider and patient relationships and ultimately where those patients are ultimately receiving that subsequent care from a specialist. So once again, this is a reiteration of a data set that HSG has that is being reported to clients. So that being an example. There are more things that would live within that potentially, but kind of shifting gears and thinking about a different data set or different data sets is then being able to maybe if there's some sort of state level market share component that also. So we know a lot of clients that have state level visualizations and components that they like to utilize. And so if we want to be able to kind of measure and track what that looks like, then we can have state level market share visualizations depending on which organization we're focused on, to be able to pull those components out and pull them into a similar environment so that it's not living in some disparate system. A lot of this is not overly complex, but you can see keeping things relatively consistent from a data outporting and reporting standpoint to say patients live in X market, but let's build outputs and visualizations that kind of tie those data elements and systems together so that we can have everything cohesively in one place. We have a number of clients that then even get more granular and pull in, depending on which data source they're focused on, They may have their state outpatient and ED data sets and or other data sets that may be available, where we can have everything kind of cohesively living in one place to be a bit more specific based on what the organization's needs are.
And DJ, this is a great example of, we think the proprietary stuff, as you mentioned, that we've built on the outpatient side is just fantastic. But this is, working with the inpatient data, which, there's most organizations are utilizing their state inpatient data set. And sometimes if the outpatient or ambulatory or ED data is robust enough, utilizing that as well. But the value that we've come to learn that we're creating with HSG Dashboard for health systems is, how do we sync up market definitions? How do we sync up timeframes? How do I look at if I'm looking at cardiovascular services, I want to know about both sides of that data. And I don't want to have to go to my planning team who's bought, one person on my planning team who has a data vendor providing outpatient data, and then go to a separate person on my planning team or somewhere else in the organization who's in charge of the pulling down the data from the state internal or state inpatient data set, and having those two data sets look and feel very different and live in disparate places in the organization and not, be comparable side by side. And so, one of the things we've learned about, how we can best serve health systems is let's take all the data that we're making decisions with and let's get it to look as similar as possible and sync it up as much as possible so that we can jump back and forth between looking at, the inpatient side, the outpatient side, how we're doing from a patient retention perspective, and have that all in one place. To make it as easy as possible to make decisions, as opposed to be a data analyst and trying to combine all those things.
Yep. And so one other element I might touch on quickly that we hear quite frequently is we do a lot of, so say we use census level information that we can do market demographic visualization type things. But one component, especially when you think about strategy, that we think is a huge focal point, our clients tell us is around kind of provider supply and demand. So obviously, how do we demand the number of specialists, primary care providers, et cetera, that we need in the marketplace? And then how do we obviously realize what's our current supply in the marketplace to kind of feed that? So one element that we've had be a core focal point to where Travis is going, that we found this to be an element that's pretty stagnant in most organizations, where it's a lot of, pure one-time reports, not really interactive, things like that. But as Travis was saying, everyone in the organization probably has a different purview that they want to think about their provider demand and current, recruiting initiatives, things like that. And so we can start to break down what is across any specialty in one place. How do we identify what's the current demand for that specialty across our market? What's the supply, both from a physician and advanced practice provider standpoint? That can be very specifically strategic, obviously, in supporting, where do we need to put some initiatives for outpatient ambulatory growth and or other strategic initiatives to obviously bring more patients to the system based on what our initiatives are.
Yeah, and DJ, you said the right word. A lot of organizations don't approach this well at all, or their approach is stagnant. And so, what having advised a lot of clients through, building a medical staff development plan or some provider workforce plan, recruitment need by anecdote is very frequent within organizations because the data is really so poor. And there's a lot of data sets that you want to consider when looking at, what does the next 3 years of our provider development look like? And so, yeah, you might have a static provider needs study that hopefully is within the last year, but could be as old as 3 or 4 years. But that's just one component. We also want to look at, what are our succession planning issues? What are the access and capacity issues within our employee network? What is our strategy and what is our positioning in the market from a market share perspective across key specialties? And how does our provider complement and alignment with the existing provider complement? How does that impact where our strategy needs to go? And all of those things need to feed into our recruitment strategy to make sure, recruiting the right providers, put them in the right places, and when we get them, that we're going to make them successful, as opposed to having them come in and sit and be 25th percentile performers. So everything we've built here is designed to kind of amalgamate all of those data points, and give our health system teams kind of a one-stop shop for all the data they would need to shape their organizational plan. And it's also something our team, on the advisory side, can work with your organization to help utilize this data to build and continue to update and refine that plan.
Yeah, and the one additional comment I might make on that we think is a bit unique is where Travis was going, is thinking about the current, providers we have on staff and how they're utilized, the current provider complement. How do we think about replacing that? And realizing that it's not always going to be one-to-one, where this specific example, in addition to just pure supply and demand figures, but thinking about, of those on our staff now that are maybe 65 or greater, or projected to be 65 or greater, what's the productivity from a total service line perspective of those select specialists? So this example, there's 5 FTEs that make up 60,000 work RVUs, which is actually 20% of our entire cardiology service line from a general cardiologist standpoint. So in the next 3 years, potentially, we have to think about how do we replace up to 1/5 of the current capacity that we have. That's just to keep up with current levels. That's not even thinking about incremental growth, outreach, things like that. That's just kind of keeping the status quo. And so it creates kind of a separate layer of discussion around how do we start to get into, what future development looks like for the organization. So everything to this point has been the first I discussed on pure data access. As you can see, there's tons of different things that our clients can potentially have access to. A lot of these, and most of them, are custom built to the client and what their specific needs are. The one piece that's, I think, important to note is that none of it is cookie cutter, that it's always kind of continuing to be iterated upon based on what the specific client needs and initiatives are. But as you can see, there's still lots of moving pieces, even though it's in one place. And so the next element of that is, how do we take all those separate, disparate data sets and turn them into information that's easily digestible and kind of disseminable through the organization? And so that's kind of what leads to where I selected our My Reports functionality. This is where we can more or less scope with the client based on their needs and what their engagements look like. What information do you have and do you need for each of your separate cohorts? So we put together a sample. Executive leadership probably needs some level of detail. Medical group leadership probably needs a different level. And then there's going to be service line level leads that have, probably a lot of detailed initiatives and analysis that they would have access to. And the way that we then have structured this with clients is we can then more or less create scripting in the background to auto-generate reports on whatever time interval is appropriate for their organization. So new data elements get updated. How do we write a script that can auto-generate a report that they don't have to go build anything? They have the ability to, as we just went through, but what we found is that people, one, don't have the time and energy to focus on that. So how do we take some of that burden off of them and then build reporting outputs that you can see? These are a lot of the visuals that we kind of walked through a second ago, but very focused on the specific needs of the organization. And then this report can just kind of be auto-generated and pushed into the system for them to be able to share within their organization, as appropriate to the correct stakeholders. So really trying to think about how do we even take an additional layer of work off of our client base to make it as easy to take very complex data, translate it to information that they can start to make decisions off of. What, Travis, from the My Reporting section would you like to focus on, if anything? Any other comments?
DJ, you covered the purpose behind us building it. I think that what took us down this path, and just talking out loud here, a lot of what we've developed, we had some preconceived notions of what health systems were struggling with to put their arms around as we went down the path as a company of developing this kind of approach to data aggregation and visualization. But a lot of what we've ended up building is basically what our clients over the last 2 years have told us, we need X, or we can't get our arms around Y. And we really got down the report of building out down the path of building out this My Reports section, because we had a CEO ask us a very intelligent question. He said, I appreciate all the data that our team has access to and we're utilizing it, but I have an executive team that needs to know one level of data. I have a board that I don't want to see too much of my data, but I want them to see certain elements of it. I have a physician network that needs to be utilizing this data, and I have service line leaders who need to be utilizing this data. And I only have so many people realistically that can know and understand what this data is, how your system works. So help me resolve that. And the solution, as DJ, as you pointed out, was, we really needed the ability to work utilizing all the great data in the system to work on some way to aggregate it in a customized way to whatever, in that case, that client needed. So different levels of reports throughout the organization that gave either the broad or granular detail on what they were looking for in an easy way that didn't require one person on their team to spend 40 hours a month building these things, but instead, just come in for five minutes a quarter, download the reports, stick them in emails, and push them out throughout the organization. So one, it's a great example of us trying to partner with our clients and build what they need. But two, I mean, I think their observation was, once we started talking to our other clients about it, the same observation. We need a way to get this data throughout our organization. We need our organization working off of one consistent, coherent data set that they all understand. And so that's where this has been very valuable.
Love it. And I promised Kelsey that we would leave a few minutes for Q&A. So the last 2 minutes that probably even warrants a follow-up session of its own potentially, Kelsey, is everything else that we didn't even touch on is the educational aspect of things and ongoing learning. So there are lots of other disparate elements that are included in here, but a large ask in the focus, an incremental focus on building, was around ongoing kind of lunch and learn educational sessions, if there are thought leadership elements. So a lot of questions around, yeah, we have great data. How are your other clients using similar data sets? What success are they having in using similar data sets to make decisions off of? How do we continue to just educate how to actually access the system and export visuals, things like that, as well as then if there's other kind of just general thought leadership presentations, national presentations, things like that, that many, if you were to go kind of like through our formal website, oftentimes it's gated content that we more or less have to approve. Travis Ansel is a good person. He should be able to access that, kind of taking some of that onus off of the clients so that they can, have access to those materials and utilize them in a more effective way as they kind of apply their data to what they see happening elsewhere in the marketplace, whether near or far. So I truly might not spend as much time on that, just given time frame, but maybe Kelsey, with that, if there's maybe questions, just to kind of, I know we have only about 5 minutes left. Were there any questions that came through to maybe kind of skate us to the end here?
Yeah, we actually do have a couple questions. The first question that someone sent through, they want to know within the dashboard, is it possible to create reports or export your data in specific views or workbooks?
Yeah, so the short answer is yes. Let me walk through maybe a quick example of that, just so everyone on the call can see. This would be more if we were obviously partnered or engaged around something, you had workbooks that you had access to, then within the actual environment itself, if you had custom reports you wanted to build and or other visuals that you were structured around or wanted to build structure around, then you have the ability to, even within the environment itself, actually export either data and or visualizations, kind of in this bottom right selector I made, where maybe you just like this picture and or graphic that you have to pull into a separate presentation, if that's maybe the need. then you can actually just export the image itself. It shows up in a nice, pretty PNG file. So that being a focal point, just based on your internal utilization, as well as you can develop kind of full PDF and or PowerPoint based reports from the system. So kind of what, like that scripting that we're going through with clients, it's using the similar structure where based on whatever workbooks we have within the system, you can actually kind of go through and select which of those visuals do I like and care about the most. And I'm just selecting a handful. But we purposefully then, when building actual reporting visualizations, the majority of our end audience is executive and or vice president level individuals of that nature. And so what they want is information, like we've talked about and kind of reiterated, for them to have access to. And so you can very quickly generate a PDF based report that has, this is that overview we were just looking at, a nice map that starts to pull all of the data elements visible. This is going to be the overall kind of share trended over time, so we can identify which organizations are shifting or not. Let's start to break that down by market area. So by primary, secondary service area, let's maybe get more granular to individual markets or counties based on the level of detail that's available. And also then that kind of sub-service line selector, we can get very specific to say, across all of those sub-service lines in our market, where are we strongest, where are we weakest, where are we losing or gaining share. So trying to, as you can see, that took, 20 to 30 seconds, very quick to build your own custom reports as needed as well.
Great. And we've got one more question that came in. Someone wants to know, is it possible to see samples of our data in the different workbooks that are available?
Yeah, so in short, that probably is an it depends answer is the one that jumps out to me. So like we talked about, or have kind of throughout, depending on which workbooks are of interest to you and your organization, some of them are easier to build than others. So if it's something that utilizes HSG claims-based data set, that is, like I said, something that's nationwide. We can kind of build that pretty proactively for most clients. If it's using state level data, there's typically some sort of data pull, data query that has to take place for us to build that out. Or if there's certain, like if it's metrics around your employee provider network, productivity, compensation data, things like that, that's where it gets a bit more granular too. It would have to be kind of customized to you and your organization, and probably be like an ad hoc pull from you to kind of build some of that out. But we do that for clients through like the business development kind of onboarding process all the time. So depending on which is of most interest, definitely something we could kind of work through and troubleshoot. The speed and time frame just might shift a little bit.